Foot pain and numbness, causes, treatments, and prevention. Hello, dear friends and viewers of the Energy and Health channel. We're glad to welcome you here again. Today, we'll talk in detail about what to do if your feet hurt or feel numb. In our previous video, we already discussed the main causes of foot pain, and there are three. 1. Heel spur, or plantar fasciitis. 2. Achilles bursitis, or Achilles tendonitis. 3. Arthrosis of the first metatarsophalangeal joint. Now let's take a closer look at how each condition develops and how it can be effectively treated.
1. Heel spur, or plantar fasciitis. Plantar fasciitis is one of the most common reasons for heel pain. It develops due to inflammation where the plantar fascia attaches to the heel bone, often caused by prolonged standing, excess weight, or uncomfortable shoes. The main and most effective method of treatment today is shock wave therapy. Why? Because plantar fasciitis belongs to a group of conditions called enthesopathies. That means inflammation at the attachment point of tendons or ligaments. Shock wave therapy works best in such cases. During treatment, acoustic waves break down the crystalline structure of calcium deposits, or hydroxyapatites, and stimulate blood flow and tissue healing. Usually 5 to 6 sessions are enough to eliminate pain completely. In most cases, the disease does not return. In the past, doctors relied on repeated injections and anti-inflammatory drugs, but shock wave therapy has replaced all that, providing faster and more stable results. Prevention tips: stretching exercises for the plantar fascia, wearing orthopedic insoles. Remember, the insole doesn't fix your foot. Its purpose is to support and unload it where excessive tension occurs. 2. Achilles bursitis and tendonitis. Pain behind the heel, especially during walking or climbing stairs, often indicates Achilles bursitis or tendonitis. The causes are usually mechanical: tight shoes with hard backs, stiff heels, or high platforms that constantly rub or press on the tendon. Treatment includes shock wave therapy, the gold standard, or, if it's contraindicated, for example in children under 14 or people with severe osteoporosis, physiotherapy aimed at reducing inflammation. However, the most important factor is changing your footwear. Sometimes, simply switching to comfortable shoes with a soft heel counter is enough to eliminate the problem without medication. For chronic cases, regular stretching of the Achilles tendon helps prevent recurrence and maintain flexibility.
3. Arthrosis of the first metatarsophalangeal joint. If you notice a painful bump at the base of your big toe, this is often arthrosis of the first metatarsophalangeal joint. Over time, the joint deforms, causing pain and stiffness. The main rule: choose the right shoes. They must have a rigid, thick sole and a heel height up to 4 centimeters. When you squeeze the shoe in your hands, if it bends easily, it's not suitable. Along with footwear correction, doctors recommend orthopedic insoles to support the arch, shock wave therapy, and anti-inflammatory medications. If the deformity is advanced and conservative therapy no longer helps, a surgical correction may be necessary to remove bone growths, exostosis, and restore the normal shape of the joint. Rehabilitation takes about 3 to 6 months, depending on the severity.
4. Morton's neuroma. A less common but very painful condition is Morton's neuroma, a thickening of the nerve between the metatarsal bones, usually between the 3rd and 4th toes. It occurs due to tight shoes or an anatomically narrow foot. Patients feel burning or stabbing pain, especially when wearing narrow shoes. Treatment includes shockwave therapy, local injections or nerve blocks to reduce inflammation, switching to wide, soft footwear. After the course of therapy, the pain subsides and walking becomes comfortable again. 5. Numbness and spinal hernias. If your toes feel numb, the reason may not be in the foot at all, but in your spine. If the first, second, and third toes are numb, the problem is usually a herniated disc between L4 to L5 vertebrae. If the fourth and fifth toes are affected, the hernia is likely between L5 and S1. The diagnosis is confirmed by MRI. In most cases, the treatment is conservative. Over 90% of patients recover without surgery. Therapy includes physiotherapy, magnetotherapy, reflexology, and gentle exercise therapy. Anti-inflammatory injections, or blocks, near the compressed nerve root. When conservative methods fail, microdiscectomy, a minimally invasive surgery, may be performed. It takes about 1.5 hours, requires only a small incision, and patients can stand up just 2 hours after surgery. Pain usually disappears immediately, while numbness fades gradually as the nerve recovers. If numbness persists for many months, it can become permanent, so early diagnosis is crucial.
Polyneuropathy. If you feel as if you're wearing a tight sock with numbness, burning, or coldness in your feet, this may indicate polyneuropathy. Surgery doesn't help here. Physiotherapy and massage are often ineffective. The only real solution is to treat the underlying cause. For diabetes, strict blood sugar control. For toxic exposure, removing harmful substances. For vitamin deficiencies, replenishing vitamins B1, B6, B12. To ease pain, doctors prescribe anticonvulsants, originally made for epilepsy but effective for nerve pain. Antidepressants that reduce nerve sensitivity. Non-steroidal anti-inflammatory drugs, or NSAIDs, for comfort. These medicines don't cure the root cause, but improve quality of life and reduce chronic pain.
Conclusion. Pain is your body's warning sign, but numbness and weakness are even more serious signals. If you notice them, don't wait. See a specialist. Check your spine, nerves, and blood flow. Choose comfortable shoes. Keep your posture. Stay active and monitor your health. Life keeps moving forward, and every light, confident step you take is a sign of health. Thank you for watching. If this video was helpful, please like it, subscribe to Energy and Health, and share it with those who might need this information. Stay healthy, strong, and full of energy.